team. Before I start, some of you in the audience, and as we saw on stage, you are all getting some visual information about me, but those of you who are visually impaired are not. So typically I start by saying I am a brown person with mostly black, some white hair, wearing a white shirt and blue jeans. So now everyone has the same information about me. But anyway, let's start talking about mental health and why it's important, I think, to move away from the clinical to a psychosocial approach, because sometimes if we look at mental health only as treatment or as counseling, we don't ask certain questions. And what are those important questions? Who has safe shelter? Who can access water, toilets, food without fear? And whose existence and whose bodies are policed and criminalized in public spaces? These questions show that mental health is also a social outcome. And in the sense of climate, it really connects to the social and political conditions that can affect our mental health. Housing, livelihood, discrimination. Do you want to translate now? Or at the end? Acha, theek hai. So first, of course, homelessness is structured, it's not random. And I think those of us who work in mental health really do need to understand that. And I know that you had some discussion on this yesterday and you'll cover it more later today. But it isn't random. Persons with mental illness, queer trans folks, those who are oppressed by caste, religion, it's not an individual failure. There is a systemic crisis, and in that sense, homelessness is a very visible sign of our hierarchies of caste, ethnicity, gender, sexuality, religion, and of course, ability. So, I think before I even touch upon the intersection of mental health and climate, I want to say that distress from being homeless, of course, comes from policy choices and prejudice. It's not happening in a vacuum. It's not a personal weakness, it's a systemic failure, and that leads to layered traumas. What happens daily? Violence, humiliation, disruption, fragmentation. And of course, when all this is happening on a daily basis, there's no time for rest, healing, or planning, right? It's not a side effect, it's a constant. And especially for persons with mental illness who may have been institutionalized and then rehabilitated out onto the street for nowhere to go. For queer trans folks, again, the repeated loss of safe space, forced relocations, all of this accumulates. There's chronic shame, there's vigilance, there's despair. And unfortunately, what happens is that whatever policy failures we have replicate the disempowerment that homeless folks are already enduring. Now, what happens when I get climate change in the mix? Environmental events worsen existing vulnerabilities. In that sense, natural disasters just follow social patterns, right? And the same goes for extreme heat. Those without homes, those who have to sleep on pavements. That leads to, as you just heard before me, irritation, cognitive strain, insomnia. The lack of access to water and shade is again constant trauma. And of course, women, disabled folks, trans folks face some added risks, right? Unsafe sleeping locations, unsafe night shelters, having to choose between safety or safety from heat. For disabled or elderly individuals, immobility in heat waves can be deadly. Those people who do take thermoregulation, and that's when cooling becomes really, really important. Of course, what everyone faces is financial insecurity and anxiety when there's a heat wave out there and they're doing informal labor. if your social position denies you resources, climate change amplifies that massively. And I think that's what those of us who work on climate and mental health need to keep as a center focus. So this is really vital, and again, just to give you an example, in terms of mental health, a person with schizophrenia or living with bipolar is already vulnerable, but there is also a further biological disadvantage when heat intensifies. And that intensifies physiological stress, which of course affects one's mental health. And part of this is because behavioral and environmental constraints matter. Housing, green space, shade, airflow, again, all things that were said by the people on stage before me, right? They shape whether people can behaviorally adapt. Now this is for the climate folks in the room, right? Seek shade, ventilate, access water. And homeless folks are less able, they have barriers to access adaptive resources, good nutrition, physical fitness, cooling appliances. And food security is a good part of this puzzle, by the way, for not just mental health security, but also for buffering from climate change. Now, I'm sure that some of this was spoken about yesterday and further, but homeless communities and mental illness have a very, very inextricable relationship. And less access to care and less access to cooling means that overall heat resilience is not something that can even be accessed. Elevated rates of dehydration, heat stroke, and cognitive as well as physiological deterioration, substance dependency within homeless communities is just a way to cope with what's going on in life, but that again has a knock-on effect when it comes to thermoregulation and heat. So in other words, heat is a crisis stressor, and in terms of policy design, it is a crisis stressor whose social, because for homeless people, because their social position denies them adaptation, as the organization has done, lead with lived experience. And yes, shelters are important, but also again, Tarannum, I think, spoke about a survey that was being done, right, in her ilaka. Figuring out which environments just need to be designed to be cooler environments, whether it's greening, green infrastructure, regulation of building materials, reflective surfaces, etc. Those are essential. We can't stop at saying shelters need electricity and water, etc. We need multidisciplinary, multi-stakeholder governance. Yes, mental health, but also physiological health, which is absolutely critical for homeless communities, because homeless folks are disproportionately vulnerable physiologically as well. The other things that, in particular, I think both mental health and climate change folks have to ask for is a housing first policy in terms of in terms of taking a mental health and justice approach. And whatever this housing is, permanent housing or shelter, has to be accessible, gender inclusive, and climate resilience. We are not going to have recovery for homeless folks in the heat unless we have a roof and ventilation, okay? Heat resilient cities overall, and homeless folks must be included in heat action plans. So it has to be open and accessible cooling centers, of course, but shade and hydration points in informal settlements, early warning systems in local languages, and legal orders during heat waves or cold waves for that matter, to prevent forced evictions. Now this is something that the government can do very easily. Heat policy is mental health policy in that sense. We also need to keep some focus on the fact that physical, nutrition is also important to safeguard persons with mental illness, persons with other disabilities when they are homeless. So body strength, nutrition are important, I think, to ask for as mental health professionals as well. The other thing is laws, such as anti-begging laws and police harassment. Yes, I would call it a mental health issue and a climate change issue. It is very important to, again, ask for this accountability to stop creating terror and instability amongst whether it's queer trans folks, whether it's Dalit street vendors or Muslim migrants. Very important, again, in terms of both climate change and mental health. And overall, I think the other brilliant thing about having so many groups that do work on this, like the groups mentioned here, is peer support and outreach during heat waves, making information accessible to people so that they know what to do, because death through dehydration is common, but it is also easily preventable, and peer-led outreach can be one such tool. And finally, I want to say that livelihood and basic cash transfer support is one other tool that one can look at, maybe even parametric insurance for homeless folks during what we call environmental events, to protect against things such as dehydration, mental illness worsening during heat waves. I mean, I think, looking at homelessness, heat, and mental health, the idea that we need to build a new imagination of care, and care as collective infrastructure and not individual rescue. Care in that sense and climate justice looks like shaded streets with drinking water. It looks like ramps and shelters. It looks like halting evictions during extreme heat. It looks like a Dalit woman worker returning home to a cool, secure room and being able to have a bath, right? For those of us who work on mental health in the room, the idea is not to build more counseling centers, but to create cities and public environments that don't amplify despair. Yeah, that's it.
मैं कोशिश करूंगी इसको थोड़ा